Oh.
Look, I'm doing it for you.
That was great. Hi, we're live.
Yay! Ouch. Yay! Good morning. Good afternoon.
Afternoon. My name's Dr. John Robinson.
And I'm Dr. Christina Bosch.
And we're known as
the Sex Docs.
Today we're definitely known as the Sex Docs. We were at Sonora Living this morning, weren't we?
Mm-hmm. Yeah, with Susan.
And we were talking about infertility. So yes, remind everyone that we are definitely the Sex Docs, and hopefully you can read that. I think that that's going in the right direction. But yes, I think that's going in the opposite direction. That's what it is.
It's the opposite.
It's going the opposite direction. So you have to read this backwards to understand.
We need to invent glasses.
Yes. Oh, that's a good idea.
Damn, that's my idea.
Google has already stolen it.
Yeah, right.
So yes, we want to talk about male infertility because that's what we were talking about today on Sonora Living, and we had a lot of fun this morning, didn't we?
Yeah.
So huge epidemic, infertility. So this is definitely not just about infertility, but particularly low sperm.
Sure.
So that's definitely backwards.
How's this working? Oh, it's because we normally have the camera flipped. All right, well, how about we read it for you? That says, infertility, low sperm. One of the interesting statistics that we like to provide with regards to infertility is that 1 in 8 couples nowadays, at least in this country, are experiencing problems with fertility. And the reason that's significant is because now about 50% of those challenges are coming from the male, so problems with the quality and health of the sperm, whereas before it was predominantly considered a female issue if there were problems with conception.
Yeah, and I think that in part what we're seeing is this generational decline in testosterone and in sperm, where maybe in the past they weren't as worried about it. Even recently, the World Health Organization has lowered the upper end parameters for what acceptable sperm counts are, and that's probably because we're just overall ranges for all kinds of tests will change based on population trends. So yeah, it becomes norm, even though it's not necessarily normal. It becomes norm within the population, and when they sort of determine an upper end or a lower end of a particular range. So we've seen that change recently.
Right. So just to distinguish the difference between the word common versus normal, and we say this a lot, just because a symptom is common, just like, oh, we've had 3 generations in a row where the quality of the sperm and the testosterone count, the sperm counts are getting lower. 3 generations in a row, they're lower for males. Once that becomes common, then the levels get lowered, which then becomes the norm. And we like to liken it to, I remember when I was in high school that they adjusted the SAT scores. And I remember thinking, well, what's the point of that? It's just making us look smarter. It doesn't mean we're actually performing better. Right?
Right.
So it's the same thing with this.
It's kind of a false thing, absolutely. In fact, the upper limit for sperm, according to the World Health Organization, is considered normal is about 20 million. But most experts really believe it needs to be around 40 million in order for it to be optimal in terms of pregnancy. But back to what you were saying, it's about 50% of the time the issue really is men. And so what happens, unfortunately, is that the male is often not considered. There's such a focus on women in terms of fertility and a preconception process. It's just all about the women. And they might not at all be the problem. It might just simply be the guy.
Yeah. So 2 points of that. First of all, or the first one is, because we kind of just jumped right into it. We didn't do any sort of like a delicate introduction here. We just got straight into the problems.
How should we be
fertility.
delicate? What would delicate look like? Like what would we say?
Let's talk about fertility.
Yes.
But
I feel so much more like sensitive now. Yeah, I feel like it's a.
Do you feel understood?
Yeah.
So what I wanted to mention was that for those listeners out there that are thinking, well, I'm not shopping for conception. I'm not in a mindset of getting pregnant or my partner getting pregnant. But what's really important to know is that sperm quality and testosterone levels are a good indicator of overall health for men, correct?
Yeah. It's a biomarker. So a lot of male patients come in and we have ways to be able to improve testicular function even in the midst of hormone replacement therapy. And I say, yeah, it's a great thing. It helps to improve sperm. And guys go, they're maybe in their 50s or whatever, or just past a point where they're wanting to have kids. And they go, I don't care. But for us, we always want to keep the motor running, so to speak, on the testicles and make sure that the sperm sperm is as optimal as possible. Motor running, I like that. We want to make sure the sperm is optimal because lowered sperm is associated with an increased risk for death and mortality.
Right.
It's associated with increased risk for cardiovascular disease, diabetes, osteoporosis. All of those things are also associated with low testosterone. And if you have low testosterone, you have low sperm typically, and low sperm and low testosterone. They just go hand in hand.
Right.
So it's a biomarker for health.
And this is a good segue into my second point, that when a person has difficulty with conceiving, let's say a female, the conventional approach is usually to say, well, wait about 12 months. If after 12 months of not successfully conceiving, then the physicians or your medical team will start looking into why this may be. I can tell you that working with preconception with females so often, 12 months, by the time you get to the third month, there's so much stress associated with the fact that the person isn't getting pregnant,
right,
that the inflammatory burden of stress starts to decrease the chance of getting pregnant, right? So if we think of testing testosterone, it's inexpensive, it's easy, it's readily accessible. So if you're
sperm
doing
too,
it,
I think you were saying. Yeah,
sperm, that's what I mean.
Right, both.
Yeah, so if you think to yourself, well, this is a biomarker that's easy to get done and economical, then wonderful, even if you're not wanting to get someone pregnant.
Right. So let's get into a little bit of, that says hot dog and it was supposed to point. Oh, look, it looks perfect. It's amazing how it went that way.
You see? That's what you meant, right?
The arrow just kind of went in your direction.
Isn't that what he meant? Oh, sorry.
Of course that's what I meant. Of course that's what I meant. So,
hot.
yes.
It's hot.
So why low? Why are we seeing this? So a lot of it is from these three reasons. Again, you got to read this backwards, but it is low fat, too fat, and increased toxins.
Yeah.
So those would be the main three reasons if I had to pick, and there's more. And in fact, let me back up before we get into those three key things.
Three key things for what?
For why we're seeing this trend towards low sperm. Let me back up. We just recently went to London, where I had an opportunity to speak at a medical conference out there, an international congress, and the topic was about this trend of lowering sperm and testosterone globally. That we're seeing this, all in Europe and in New Zealand and Australia, of course in the United States, we're seeing this trend. Except Spain. The Gallegos and they're fun over there. But you digress in the midst of my discussion.
It's this time of day for us, apparently.
So anyway, I had this opportunity to speak, and I wrote a long paper on this as well. It's found on the website where you can kind of look into some of the details. So there's a lot of reasons is what I'm getting at. This isn't just as simple as what we can talk about here in this Facebook Live episode, but there's a lot of reasons. And there's a lot of implications. Some of those health implications we already talked about. If sperm and testosterone are low, there's a lot of health implications for that. But back to what we said about low fat, too fat, and excess toxins. So a lot of times why we're seeing this issue for low testosterone and low sperm is just not enough fat, right?
Good fat, good dietary fat.
Good dietary fat.
Dietary fat.
That was kind of brought up today, I think, in our segment on Sonoran Living. And I think, we didn't have enough time to probably really delve into it. Let's try to do it a little bit now. When you say low fat, when you say good fat, people think low fat. They think that it needs to be this quality fat that doesn't include animal fat. And I think that's one of the biggest misconceptions.
Yes, fine. But I think, again, referencing back our Sonoran Living episode, that I think the point here was that it is about quality of fat. It is about quality of fat. Mm-hmm. And that a hamburger isn't a hamburger. If you're having a gourmet hamburger because you bought some grade A, organic, grass-fed, no hormone beef from your local butcher and you're making that at home, that's not comparable to one of these low-quality fast food chains, right? So when we're talking about animal fat, we are talking about the quality of the animal fat, whether it's in the form of meat or dairy or egg yolks. Goodness, egg yolks. Eat your egg yolks. They're not making you sick.
But I think this has been part of the problem, that we still associate this idea of good fats largely being in and around vegetable fats. Mm-hmm. And it's just not true. And yes, we can get some good fats from that source as well. People will typically say avocados and those kind of things, and that's all true. But where you're going to get most of the fat-soluble vitamins, the best quality source of fat-soluble vitamins, vitamin A, vitamin D, vitamin E, vitamin K, all important for sperm and testosterone health. The best source is going to really be an animal source.
Right. So let's simplify. Number one, eat fat. Fat is important. Fat does not make you fat.
Right.
And fat, because it houses fat soluble vitamins like the ones John was just mentioning, they really have become a deficient source or a deficient nutrient in the American diet because of the low fat craze. So we're clarifying. Fats are good, but good fats are good. So that's going to come from good quality animal sources like animal flesh,
yes.
right? Red meat, fatty fish, etc. It is going to come from vegetarian sources like your avocado, like your coconut, your olive oil, your hemp seeds, those kinds of things, right?
Absolutely.
Dairy and egg yolks are also a good source of healthy fat.
Butter, high quality pasture-raised butter is extremely high quality fat. It has all kinds of health benefits beyond just simply the fat itself, but again, those fat-soluble vitamins that are found in a huge abundance in high quality butter. There's different sources.
And since we're talking about fertility, we're saying that from a preemptive perspective, you'll have a better quality of sperm count, motility, morbidity, meaning the actual sperms themselves will have a nice healthy shape when you have good quality fats in the diet. But then also for the female, very important for hormone production, and once you do conceive, right?
Yes. Yeah, and also, you know, they call these sacred fats for women, and ancient cultures have known this for millennia, that high quality fat is important for preconception, during pregnancy, during lactation, and then those fats also being transferred and being given to the child as well, because they need that for their brain and all kinds of developmental things and processes in their body. They need fat. So we've always known this instinctually, and it wouldn't have been a low-fat diet. You just don't put children on a low-fat diet. It just doesn't make any sense. And the same thing would be for preconception. Right?
And then for postpartum.
Absolutely.
Okay, so what else? That's the fat. Oh,
so, and also then, of course, too fat, meaning one of the big reasons why we see low testosterone, low sperm is because people are just overweight.
Correct.
So obesity will lead to a decrease in production and the quality of both testosterone and sperm.
Right. And then, since, again, I keep bringing it back to from a female perspective, a healthy woman is a healthy pregnant woman, a woman who is physically active. Non-pregnant is a woman that is physically active pregnant, and if you're going to be putting 30 to 40 pounds on during pregnancy, you want it to be because your baby and your placenta and your uterus are all well nourished, and you want to make sure that it's because you're back from being an avid mover, that your back is nice and strong and your core is strong so you can carry that extra weight.
You know, you're bringing up a lot of great things that that we tend to associate with females because of the pregnancy process and all of that again, then the focus certainly becomes on the female once they're pregnant. But in order to have the best quality sperm, so now we're not just talking about count, like you were saying, morphology, how those little guys swim around, and then and then how they really the quality of the DNA that they're passing on.
Right.
So again, this is all preconception things. So guys, we need to think about those things when we're thinking about pregnancy. How can we pass on the best possible sperm for the sake of the baby and for the sake of the viability of the pregnancy and all of that? It's totally part of that. Which is, guys, it tends to be this thought of just, you know, wham bam, thank you ma'am, I'm done, and it's all over with once I've done that portion of it, and it's just not true. There's a lot that should be thought of prior to that.
Well, I think that's also an important concern when we think of, I mean, if we get a little bit more philosophical here, there's contribution from the male. This isn't just I need sperm so that I can get pregnant. This is a being that is being brought into the world. Like John always says, we're raising good citizens. It is going to be 50% coming, at least just from a egg and sperm perspective, from the male. So you want to know that you're contributing as a male. You want to know that you're contributing your winners. You want those sperms to be the guys and the girls that got there first. This is also, I think, a good philosophical subject with regards to the fact that we want the fathers to be involved, right? We want the male to say, I didn't just contribute sperm, I'm contributing self, and this is your legacy. So
that's a great way to put it.
My soapbox moment.
No, I think that's wonderful. And I don't even think that's philosophical. I think it's certainly not necessarily even metaphysical. I mean, it really is something that's really practical in what we're talking about here. So I think that was well said. Well said. So what else? So of course the toxins.
Yeah.
I always say if I had to pick one, I would probably point the finger to elevated toxicity. It's certainly what most scientists and doctors are talking about in terms of trying to figure out why are we seeing this issue, particularly with low sperm.
Right.
I think it's the toxicity, environmental toxicity.
And then these are referred to as
Endocrine disruptor chemicals. Another name for it is actually obesogens. This really brilliant woman scientists had figured out this concept and had proposed this idea that these toxins were acting as obesogens. They were affecting the endocrine system and causing, at least in part, the obesity epidemic. And everyone just laughed at her, and most people in the endocrinology field sort of laughed at her. And she's definitely the one laughing now, because even the endocrinology specialty and most scientists now are understanding that there is this effect of these chemicals on the entire endocrine system, including the testicles.
that increase our chance of obesity and make it difficult to lose the fat.
Difficult to lose the fat, and that's a thing. And what we're understanding now, fat tissue is an endocrine tissue. It is a hormonal tissue. It's not just like this static thing, and that's the way we used to think about it. And it's just not the case. So this idea of toxins affecting that hormonal system, in other words, your fat on your body and in and around your organs, but also the testicles, the ovaries, the thyroid, your brain, all these things that we understand.
The brain is a fatty organ.
It's a big old fat blob is what it is. It needs fat. It thrives on fat. So that's a little bit about toxicity.
Okay.
Here we got another one for you. This one's upside down. That says,
what does it say?
Fabulous Mom.
Aw.
There we go. Did that? No, it's...
Yeah. That's me, though. Thanks, babe.
Yeah, for sure.
How come?
Well, because I mean, you're sitting here dealing with me, and you're what you've done here for our family all these so many years. It's amazing what you do with our three girls, and so I always appreciate that. So whenever I get a chance to say it, I guess I have my little scribbles here. So why else? Why else are we seeing these things? And hopefully you can read that. That doesn't say on sex. That says no sex.
Why else? No sex.
No sex. So if you don't use it,
you lose it.
Yeah.
That's for sure.
So, and there's evidence to this now. So first of all, we're seeing that there is a lack of overall sexual interaction. We're seeing this also with millennials. They're not having sex. They're not having frequent sex. They're certainly not having committed sex in the way that maybe we used to. And if you don't drive the system with demand, it won't give it. And, your body, the system will answer to whatever questions you ask of it, for the most part.
Right.
And if you're not using it, like you said, we lose it.
Yeah. So, in other words, if you want to make good babies, if you want to make babies, start there. I mean, we've said this before. You've heard us say this on segments. So one of the things that I say with all of my fertility patients is, how do I get pregnant? I say, have more sex. We think, I'm going to time my sex so that I can get pregnant. I say, no. I mean, it doesn't really work that way. First of all, there's no real science. Even if you're doing those ovulation sticks, I think that especially once the stress component gets involved. Plus, remember, we have mentioned that the sperm can last in the system for longer than just the moment of intercourse. So,
especially
sex,
if it's healthy sperm.
Yes.
Back to what we're talking about. Yeah.
And it is also true that in the throes of orgasm, then the female body is literally absorbing. You're like sucking in that sperm a little bit more. So use it for men. Have more sex. You make more sperm. For women, have more sex. You're more likely to get fertilized.
Yeah. It is a numbers game. No, that's not gross. I mean, it's so true. So, but what we're also saying here is that as you're having more sex, you're increasing sperm. You're definitely increasing testosterone. You're giving the demand, and then with the proper nutrients and the proper fuel, and maybe some other strategies that we certainly work with here at the Hormone Zone, you can be able to optimize that whole situation. But definitely, it starts with just good old-fashioned getting it done.
And while pregnant, stay in that state of mind.
Yeah, absolutely.
Because then that keeps the bonding. And of course, that energy is just great for the fetus.
Yeah,
okay.
Good point. And then finally, again, we're all backwards here, but get tested. Get tested. I mean, how do you know? How do we figure this out?
Right.
Go get tested. It's really not that complicated. It's pretty simple to do. There are some home tests for this, actually.
For sperm, we're
yes,
talking about,
for sperm. There's actually even home tests you can get even for testosterone. When we are talking about sperm, and there are some home tests for that. They wouldn't be. It'd be kind of like saying a pregnancy test, the urine test for women. Where that's not quite as accurate. They're pretty darn accurate nowadays, these home kits, but they're not going to be what we say.
It's not confirming, right?
Yeah, it's not, because it's not quantitative.
Right.
It's qualitative, which just means, let's say with a female test, we're able to get a certain amount of that HCG that they're looking for to turn that little guy, that little plus sign blue. But it's not going to tell you the exact number, and actually the number, the quantitative test, gives you an idea of how viable the pregnancy may be. So the same thing with the sperm count test. It's going to give you an idea of a certain threshold, but it's not going to give you an actual number. So sometimes we need that number to be able to know whether or not there's any issues.
It's a good start.
Right, exactly. It's at least a good start. But again, going down and getting one of these tests, it's not expensive, even out of pocket. So if you're thinking and you're in that preconception and you're wanting to do it, just get the baseline.
Right. That's what I was going to say. Yeah, I mean, baseline is so important for the quality of the sperm, the quantity of the sperm, but then also for testosterone.
Right.
And I think one of the things that we really want to hammer home is, you heard us say it this morning on TV. You've heard me say it a million times. The concept of preparing the vessel for the female, and as you love to say,
I like to say priming the pump.
Priming the pump. I think that if you think that you might want to have a baby in the future, male or female, then think about that now. I mean, really, what can you do to nourish yourself so that the quality of your sperm or the quality of your body, your uterus, is the best host it can possibly be for growing as healthy a baby as possible. If you know your baselines, then you're armed with information. That's it. It doesn't mean that you have to then go out there and start doing it, but you're armed with information that can say, this isn't as optimal as I would like it to be. What can I do to repair that? Or, wow, my numbers look pretty darn good. What have I been doing, and how do I maintain that lifestyle behavior to ensure that my body is as healthy as can be, and that therefore in the future, my contribution to a potential baby is as healthy as it can be?
You can't fix what you don't know, and you know, measurement allows you to make adjustments and work with the right professionals to be able to make improvements in those measurements. And back to what we were saying before, that just getting that sperm count done, that's a biomarker as well. So you're getting an idea about health. Again, whether you plan on having children or not, guys, just having that number gives you an idea of, literally, like I said, mortality and other disease risks. So
and for goodness sake, be your own advocate. If you're just curious, it doesn't matter. I mean, a lot of times patients will say, oh, the doctor doesn't want to test that because they say it's not relevant. And I say, well, that's not the point. Now, let me throw out there a little point of like consideration for your physician. Please remember that once a physician orders a test, they are assuming responsibility for the results. So let's also have a little bit of understanding for the health professional that if they say no, then you can engage them and say, is this because you're not comfortable with interpreting the results? Like, why don't you want to order this for me? Because if they know that you're going to be working with someone else, then perhaps that will make them a little bit more inclined to agree if they don't want to be managing that. But otherwise, I would say, find a cash lab, find somewhere, because that is information that will arm you so that you can be your own advocate and that you can ensure you're as optimized as you want to be. Remember, John mentioned earlier, low testosterone for men and women. Yeah, sperm count, etc. But we're talking about bone health, heart health, mental and emotional conditions like anxiety and depression, obesity risk, or just feeling like you got a good workout, right?
Yeah, it's brain things, Alzheimer's disease. I mean, the list goes on.
Yeah.
So because we know that testosterone relates to sperm, and getting that number just gives you a little bit more information about how healthy you are. One thing I was going to say too, I think a lot of times doctors are not wanting to sometimes assume that responsibility, so they're resistant. Another thing is there's a trend to want to not test if they don't think it's worth it, and or to be minimalistic with how things are tested. We see this all the time with general practitioners not wanting to check testosterone for women. We've ordered it. A patient tries to run it through their primary care physician, and they just don't want to do it because they don't think it's necessary, or they're trying to do sort of a minimalistic approach. They're trying to save money in a lot of ways, and the way they're seeing it.
We get it.
Yeah, and we understand that, but
do it anyway.
Do it anyway, absolutely. And getting more information is part of your health, and it's really your right to be able to do that for yourself.
Yeah.
Especially when there's medical freedom, and something that we're really keen about.
Yeah. So
here's what we definitely know for sure.
Hormones are sexy.
And sperm is sexy.
Healthy sperm
Healthy
is sexy.
sperm is sexy. and healthy is a lifestyle. Is there anything else?
I love you. I like Sean with a beard.
Yes, this is my No Shave November, and remember, No Shave November is actually about cancer, but for us, I think this month it's becoming a lot more about male fertility
Just
and
men's
sperm
health
and men's health
awareness.
awareness in general.
I mean, you guys, you deserve it just as much as the female does. So get out there and speak up for yourselves and find someone that'll listen. And if not, you've got the sex docs.
Yeah, we're here for you. We'll see you next week. I don't know exactly what we're talking about.
We won't see you next week.
Oh.
We won't.
No? We would
I don't
maybe say
think
hello
so.
real quick?
Perhaps. We will be bouncing around next week. Alessandra's getting baptized, so we got a bit of things on our agenda. But we'll pop in and say hi, and we'll definitely send in a Thanksgiving note of gratitude.
Yeah, and we got a lot to be grateful for.
Indeed.
So we'll see you next week.
Bye-bye. Take care.